Hello friends, welcome back to my channel. And today we are going to see about infant feeding. And I will cover all of these topics in this video. Before that, did you know when should we initiate breastfeeding? The breastfeeding should be initiated as soon as possible or within 1 hour of childbirth. So now we will see what is exclusive breastfeeding. The child should be fed only the breast milk and which is recommended for 6 months. We should not even provide a sip of water unless medically indicated. What are the reflexes that help in mother and baby while breastfeeding? In mother, the milk secretion reflects by prolactin. The prolactin, which is produced by the pituitary gland and which causes the breast to grow and develop, and which leads to the milk production after the baby is born. And milk ejection reflects by oxytocin, and this oxytocin which helps the baby to get milk easily for the current feed. In baby, the rooting reflex by gently touching the corner of the baby mouth, the baby will turn his head to root in that direction. Sucking reflex as the roof of the baby mouth is stimulated, it suddenly starts to feed. What is a good position while breastfeeding? The body of the baby should be well supported. The occiput, the buttocks, and the shoulder should be in the straight line. The baby should be turned towards the mother. The abdomen of the baby should touch the abdomen of the mother. So, these are the signs which indicate that your baby is in good position while breastfeeding. Some of the components of breast milk are: for the primary few days, first 72 hours of birth, it composed of colostrum, a thick bright yellow-orange in color, which is high in protein, phospholipid, cholesterol, and immunoglobulin content. Do you know which is also known as a first immunization for the baby? Some of the major differences from the formula milk are: the first one, which is casein, which is a whey protein and it is high in content in the breast milk and also which is easily digestible. And second one, which is fat, which is higher in breast milk and also which is richer in polyunsaturated fatty acid. And third one, which is a nutrition, then sodium, calcium, potassium, and iron, which is lower in breast milk. So the vitamin K injection is recommended to prevent the hemorrhagic disease of newborn. Cow milk is vastly different and should not be used as a substitute. Some of the advantages, like for nutrition, for example, fatty acid, arachidonic acid, and doxosuccinic acid, which is needed for the infant brain development. And immunological protection transfer, IgA especially. So in developing world, it gives a very significant protection against a respiratory and gastrointestinal disease. And uterine involution and maternal weight loss is accelerated. And breast milk, which is convenient and cheap and which also decreases the risk of breast cancer and which also helps to promote the bonding between the mother and infant. Some of the disadvantages, like there are no real disadvantages to the breastfeeding. It is becoming socially acceptable and politically correct to breastfeed infants in public places, including restaurants. Now, what is weaning? This is the introduction of solid foods and it is done gradually after 6 months, as the breast milk alone is not enough for their development. Different pured foods are introduced, example mashed bananas once a week initially, and baby generally likes sweet things as the breast milk is very sweet, but it is important to introduce a wide variety of flavor early. So normal cow milk should not be introduced before 1 year of age. To know more about the infant feeding, have a look on my blog. Stay safe and stay healthy, my dear friends. Don't forget to subscribe to my channel. Thank you.